Outsourcing being used to pretend hospital wait times are being fixed. In Northland, 24 patients are set to get their long-awaited gynecology operations, but Dr. David Bailey, your colleague, lead obstetrician gynecologist for the region, said, while it was good news for those patients, it would not fix the chronic underfunding and neglect of the public service over many years. He spoke on Morning Report. I'm just going to play 30 seconds of what he said, and then we want to get your take on all this conversation as well, Gary. Here he is from Morning Report.
Plan will help Northland patients get gynecology surgeries, but the region's lead obstetrician there, David Bailey, says it won't fix years of public health service underfunding.
Had that money been available over the last 12 months, we would have treated many, many more patients than they're going to be doing with this. This is a political move to make them look good.
David Bailey describes the push to go private as entirely ideological.
Throwing large amounts of money to do a small number of procedures in private to make your figures look better, to give the perception that you're actually improving on health targets, is fundamentally dishonest.
Now, last week, Gary, we came across the story, Chewie United, and being the ignorant fools that we are, we kind of thought, in fact, I think I said, if this is all it is, if it's just clearing the backlog, that doesn't sound like a bad thing. Patients getting ahead of that backlog doesn't sound like a bad thing. But of course, yourself and your colleague, David, Dr. Bailey, bring maybe a more holistic view to what this money is doing going to these private entities. Would you like to expand?
Yeah, I think Katie Ben put it well. She's a doctor, anesthetist, put it well when asked, why isn't it just a good thing that this $50 million will help people get seen in private? And it seems like a good thing. And if you are a regular person, you'd say, well, I can get my surgery that much quicker. But I think there's 5 or 6 really important reasons for why this is a dangerous precedent, why this actually leads us down the wrong path. So number one is there's a few things you need to understand that regular folks who are not in healthcare may not know. These private hospitals, many of them owned by private equity, which has been shown to utilize understaffing and result in worse outcomes for patients than either not-for-profits or public hospitals, but we'll put that aside for a moment. So you're sending people to actually get worse care. But the more important thing is these companies, again, often private equity owned, are in it to make a profit. And they siphon that profit off. And whatever profit they're making, 10, 15, 20, whatever percent, I've seen some reliable numbers of 20% profits for some of them, that's money that's not going to patient care. That is money that will not directly help a patient, and it's money that's often being offshored. So it won't even help us in the larger sense of building a stronger community.
Well,
the bigger problem.
Hang on, just so we're clear, so people are clear when we give it the number. I know people will know this, but if they're spending 50 million and 20 million is profit, that means they're spending 40 million on surgeries and siphoning 10 million off. 10 million would be 20% on 50.
But it gets worse, Pat, because we know that in private, fees are increased, again, to generate profit. They're not doing it as a community service. They don't have some public ethos. They want to make quarterly profits to report back, right? It's private equity, it's a corporation, that's how it works. And they will try to get as much as they can and deliver as little as they can. And so there's this concept that I think can be summed up as cherry picking or skimming the cream. And it is part and parcel of every public healthcare contract. So if you guys ever get the chance to talk to Simeon Brown, you simply have to ask him, how much money are these hospitals getting to provide the service? And what he will immediately tell you, he's already told journalists, is that it's commercially sensitive. That means it's a commercial secret, a business secret that he can't tell you. Because if he did, you would realize how much money is being made and how much more efficiently the public system could have seen these patients. So that's a couple simple concepts, but it goes deeper than that. Because they're cherry picking, they will only take the healthiest and least sick of that pool of patients. So you have what, 27,000 patients waiting for surgery, some in dire conditions, right? These ladies that David Bailey, the obstetrician gynecologist, is trying to advocate for, some of them have been waiting longer than a year, bleeding and in pain. Okay. And he's trying to advocate for them. But the reality is, and he knows this, when government goes to outsource these patients out to the private sector says, oh, too fat, too high of a BMI, bad diabetes, hypertension, we won't take that. Comorbidities, oh, they've got heart and lung problems. Oh, they have problems with access and travel and poverty that will make follow-up difficult. All of these are reasons why the people who need it most will not get cared for. They're going to be turned down. And the reality is the most complex patients will not even be candidates for this. They will be forced to remain within the public system, not go out in private, while private charges premium rates for it.
Let me ask you about that. Let me ask you about the premium rates, because I haven't thought of this before. Is what you're saying they're actually double dipping? Because they're charging an exponential amount for the scan that they're charging more for than you'd pay for in a public setting, and then on top of that they're making profits as well. So they're actually making profits on the scan, charging more, and then making sure there's a fat profit left over at the end. Are they double dipping?
The simple answer to that is, of course, they are trying to maximize profits by any method they can. Right. So of course they want the simplest procedures on the healthiest patients that will be in and out of their hospital quickly. But it gets worse, Pat, because if the patient happens to get sick at a private hospital, do you know what they do with them? They don't care. Exactly. Yeah. They load them on an ambulance and get them the heck out of there. They end up in a public hospital with a post-surgical complication that the public hospital now has to eat the cost on. There's no clawback of money, nothing like that. The hospital, privates get to keep the profits, but they've externalized the costs back onto the public taxpayer. So we're getting hit by, like, again and again, losing profits, offshoring profits, cherry picking, issues of inequity. If your sickest people are on a waiting list and they can't get service in the private sector, how fair is that to them? Well, it's not. And so it's essentially a way of taking the easiest to care for patients and the most profitable ones and giving that money to private.